All right, what's up, guys? I'm going to take you through a short bulletproof your knee series. A lot of us are active. We like to hike, ski, bike, all that kind of stuff. It's really important to keep your knees feeling good. It's one of the most common symptoms we see in our clinics is pain in the front of the knee. So I'm going to show you a few things that we do to make that feel better. So the first thing, if you've got a very sore knee, one of the best things you could do is isometrics, or like long hold, like squat position. So it's almost like a wall squat, but you could do it, 2 feet, just coming down, squatting, feeling that pressure, staying upright. By the way, if you are squatting or doing any movement and you lean your torso forward, that shifts weight back to your hips, shifts it away from your knees. So you're not gonna be exactly getting what we want you to get. So what I want you to do is I want you to stand up nice and tall, keep the chest up, head up like you're going up and down an elevator, and you're just gonna squat down. If you're like, hey, I'm a little bit more painful on my left than my right, I'm gonna put my right foot forward and I'm gonna put most of my weight on my left. And I'm gonna go down just to the point where I start to feel like, oh, that could be painful. We don't want this to be painful. And then I'm just gonna hold that. I'm gonna try to hold it for, at first 10 to 15 seconds, working up to 30 seconds. And I'm gonna do 5 sets of that. And this is something that I'm gonna do every single day. And the benefit is it exposes that tendon that's painful to load, but it trains your brain and your muscle that, hey, this is not a painful position. And by the way, we're using this tendon a lot. So we're gonna send all these resources to that tendon to help it repair so it feels better. And that's the start of a rehab program. Once you can really maintain like a single leg wall sit or a single leg upright kind of position like this, you can hold this for 30 seconds. It's not that much of a problem. And you don't have any pain, and you could hold, at different depths. So I could start here. Hey, this isn't painful. Then the next week I'm like, oh, I could go a little bit lower. Oh, I could go a little bit lower. So you could keep on going down lower. The next phase is kind of doing something active. And so what I like to do is either a slider forward lunge or a step down. So the slider looks like this, right? So same kind of thing. I'm going really nice and slow, dynamic, and I'm just trying to reach that slider out as far as I can. And that's putting a lot of load through my knee. Again, trying to maintain upright, because if I do this, I'm shifting back to my hip. So I'm trying to maintain a nice upright position, and I'm trying to just slide that slider out as far as I can go. Same thing can be done off a small box, right? And you can slowly work up over time. This is a 6-inch box. You might even start at a little 2-inch box. Put your foot on like a 2x4 or something, or a book. And all you're gonna do, again, reach down. I'm tapping my heel. I'm trying to feel like I'm going up and down in an elevator. I'm not riding an escalator down. And I'm trying to just load that knee tendon. So over time, that's gonna build a lot of quad strength. It's gonna expose the tendon to load. It's gonna signal your body to send the resources it needs to repair any damage. And if you don't have any damage, it's gonna keep you pain-free and bulletproof. So hopefully that tip helped you guys to not live with any pain in your knees.